Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk about a new way, maybe not so new, of restoring dentistry, of when you restore somebody's mouth using orthodontics. In other words, we're going to take extra teeth like second molars and wisdom teeth, or anywhere we've got teeth that we can slide forward and close up spaces in someone's mouth where they have had problems, they've had teeth extracted. If you have natural teeth to put into that space, that's what we want to do. And where you don't have a tooth there, you can put your implants there, excellent, or in some cases, you might want to put a bridge in place. So let's get going and see this case that we have. We're going to show several cases where we've done this restorative type dentistry here. This is the lady, this is after we finished the case, and we got excellent facial structure. No problems with that. There, the braces were on the teeth, and they got finished, and here's the smile, and here is where we started from. And this was 1100, and this was we're going to show it to '08, I think, several years after we finished it. Now this is problems that are there, just are normal problems, and they're broken down teeth. This is a tremendous closed bite. Laterals up here out of place, little bit class 2 division 2. These teeth are tucked in. The jaw is up against these teeth right here, and then the cuspids are coming down. Okay, over here we're going to have to bring that back, line it up, and then there are teeth that are dropped down into the gap. We'll show that on some side pictures here. Let's look on the side. This tooth right here was sitting back here somewhere at one time, lost its tooth in here, so it drifted over, and it's laying at an angle like that, and they're chewing with it. It's hitting it right here, pushing it down even further. And so we had wisdom teeth and other teeth back in here, except in one place. I think it was here. There are no teeth that's put in this area, but I think there's a wisdom tooth going to come in here. We'll take this tooth and move it up and have it coming right in this area, and then we bring this other tooth down on that side. Here we go ahead and put this tooth in this area, and this is where we have the missing tooth, we'll put an implant, or a person can put one in there, they can just do without it. It's another way. And so here, this cuspid's going to have to be coming back in like that, and we'll line all these teeth up. Now the teeth have worn places on them, and that you just fit that in the best you can on any of these restored cases like this. Here on the other side now, we've got a second bicuspid out here. It was in this area, and we have a wisdom tooth here. So we're going to slide these teeth up and close the space where this second bicuspid is. We'll bring this forward and use this tooth to do that. So you're going to have these right here. This tooth will be in this area. This wisdom tooth is going to be here and come out. And when that one comes down, it has a place to rest on. Right there, we'll have to take this tooth and raise it up like that. And here, this is division 2. And these teeth are jammed right up against this. Now, to my memory, the lady did not have a TMJ problem, but she's got a situation there where the jaw can't really go out where it wants to go. And this cuspid ought to be going down in this gap right here. Let's get on now. When we look at it from up above, these teeth are kind of wore off here where the bottom teeth are hidden right in the front part, and these laterals are out of place. Everything's lined up pretty good over on this side. Over here we don't have these, so we're going to move this up here. And there's one spot that we'll have to put in or she will have to put in an implant. We don't have anything to fill in the back spot back there. Now here again is the lower arch, and these teeth are crowded. As we elevate the upper teeth like this, we're going to bring them up, and it'll give us room to move this out and line all these teeth that are crooked down in this area. We'll line them up in good place. Now let's let's go here to the x-rays. When I got this patient from the dentist that referred him in there, we had thought about, and he had thought about, going in there and taking the wisdom teeth out. He was going to maybe put a bridge in this area right here and remove that. This tooth right here, he wanted to upright it maybe and put a bridge across here, or he could put an implant behind it. It doesn't matter. And here, right here, we were thinking about a bridge. Over here, we were going to take out these teeth. And I brought the patient in. We were going to open the bite. See, the top teeth come up, the bottom teeth will come up to here, and the upper teeth come down to here. In other words, just laid over like this. We're going to raise these up. We have some room to line the lower teeth, doing the same thing. All right, let's erase. Let's go on here and let me erase those lines we put in there. Now, this is a 01. Here we are starting in, and we have a tooth up here, see, coming down this space. We have taken this and moved it. Let's go back just a second. And you see this tooth is right here, and you see it's leaning this way. Now what we're going to do is put force on these roots and bring the roots forward so we can parallel that. And we will show this gap will not close right here until you get this tooth right up there. We're going to pull this one over in this area. Now look over here again, see this bridge. Let's look at this. Now I'm going to go on. Now we have moved this part of the way up here. This tooth has come in. It's headed up in that direction. We have this tooth is almost up here, but you see the tooth now is straight up and down, but this gap is the same. We put force on it by putting this little deal in the arch wire, where you run it down like that, and you pull up on that, and that pulls the root forward in it as you're closing this down. Now let's get on with the next x-ray. This is 7. Now here we are, the number 3 x-ray. This gap is actually bigger, but the roots and the tooth is almost straight. And if you notice, there's a little deal in here where we're pulling that through with the arch wire. And the way we do it is put that the wire going down like this, and have that little deal here where it's tightens that spring. This is coming closer up to here. This is down over here. This is much closer, and so we'll continue to bring this up, and then bring this tooth underneath that. And this tooth will come up, and it'll be something like that, and that'll have these 2 teeth in here, and this tooth will have a rest on the portion of this other wisdom tooth on the bottom. And we're not going to throw anything away right here. We're keeping everything. And we have opened the bite now. You see the bottom teeth are here, the upper teeth come down to here, about like that. It was completely covered in this fashion. So we open that up, and we use that with intruding wires. If you want to go with this case and everything we did, you can go. I have it in another section here, just closing space on adults, and it'll show you every step we took in getting the case to this point. Now this is number 4, and we've got this tooth that's come in here, and this one's free to open in this area, and we will bring this on up and close it up pretty good. And this person needs an implant right over in this area, so you don't want to put an implant in there after you're finished. Don't stick the thing in there before you're finished, because you can't move it. Now, we're going to try to get, when this gets all the way over here, this tooth will be about that far. This one will be coming in about this way, and this tooth will be able to rest on that part. And so we haven't wasted one thing in doing this, one tooth. And if we'd have got it earlier before she lost these back here, we'd have saved that tooth. Now this is restorative dentistry by using orthodontics. Now you may have to add bridges or implants or restore some of it other than orthodontics, but we're going to use the permanent teeth that the people have, and after they've been in for a few several months, you can't tell, the bone structure will fill in around them like that, and you can hardly tell that that's not the regular teeth that were there to start with. Now this tooth is all the way over. This is free now to come down here, and we'll have this where this will have to have something underneath it when that comes in. Now we've got this going in. Now let's take this and study these x-rays. And if you want to learn how to do this restorative dentistry by doing orthodontics, and you have to learn a little orthodontics to do it. But you will need to do it. And now we've got this. Let's go to 7, and that's all we got right here. I think we have 2 more later on in 08 and show you. This tooth will come down some more, or you could go in and uncover it and help it speed it up a little bit. This one will come up and hit here, and then just a natural drifting, so we don't have to wait until you're absolutely through to stop it. And then this will rest on part of this tooth right there. Now, here is just looking at the facial structure. This is 11 of 2000, and now we've got, this is 08. I don't have the date on it right here. The midline's right on, the teeth are lined up, the bite, the laterals are down here with the centrals, the cuspids are in their place. This is far, far better than going in here and not doing any orthodontics and restoring this mouth. So I want to get this organization I'm working with, the American Orthodontic Society, the people trained in there to treat cases like this. So we're going to try to get them to doing this restorative dentistry by using your orthodontic teeth. Don't throw them away. And your wisdom teeth are kind of like spare tires, and you keep them if you possibly can, and then you have to bring them forward with these second molars, and I've got another case going. Here we'll show you that. Now this is from the side. This tooth is leaning over. We've straightened it up, brought it up beside this right here, and brought this down, and this is where we don't have one tooth back there. It's going to have an implant in there. Now here is the other side. It is lined up. Everything's lined up in case. I'll tell you, you could show this case to somebody and they would not believe that you take this like it was and put it here. Now we've got this, I did this video on this several years ago, and I've got about 29,000 people all over the whole world that look at these, and they've looked at this case. And I'm just bringing this up that this is type cases that I want to use in restorative dentistry. I'd like to get a completely new type of orthodontic going here, fixing up the teeth or restoring them and using all the teeth you have there, your permanent teeth, use them instead of bridges and all this other stuff. But you have room to use the things when there's no tooth there to work with. All right, this is a lower arch. It was crowded. We pull that up. This tooth right here is kind of out of place. It's not as good as it could be. And this is lined up over here. They had to re-crown one of these teeth. And we finished that out. And this side over here, you're going to have an implant if you cover it. The upper now is lined up good. Everything's working out fine there. The Class 2 Division 2. This case is, in other words, the bottom teeth came up and hit these teeth right up here. And now we've pushed these out and lined them up, and your bottom teeth will just come in and fit right up against the back of this. And here is the finished product you've seen already. This is without the braces on there. And there is the final smile that we have. And let me see, I think there's some, maybe an x-ray here. Yes, this is 018 x-ray. That wisdom tooth still hasn't come down, but it can come on down here. And if it does, you'll need to put this implant in that area. Now this tooth will come up here and bump against that, and it will tend to line up underneath, and when this one comes in, it can fit right against that tooth. The root isn't up there as close as I would like for it to be, but it can drift forward some. And this is 018, and I'll tell you, this lady will have a nice looking set of teeth if she really takes care of them when she's an old lady. This was 50-something, I think, when we were doing it. And that's kind of covers it all, but I hope you get something from this. And this is something that can be done, and people can do this. It's not something that's impossible to do. Use every tooth you can possibly use that the people have. Pull them around all over. The bone structure comes in, fills it up. A year or so after you do this, you can't tell the tooth that was here and you moved it over here. It looks like the bone's been there all the time. Thank you for watching, and I hope that people that see this everywhere in the country and as far as this world, this is something that can be done, and we ought to be learning to do it. Thank you very much, and I'm going to go on and close out now. Hope to see you again.